Hello, Dr. Yang.
안녕하세요.
Nice to meet you.
네.
Can you please present yourself to our viewers?
네.
Hello, I'm Yang Song-hyuk from Korea's Hugo Plastic Surgery. Our hospital specializes in surgical procedures such as SMAS lift and other different types of facelifts.
So today we'll be talking about SMAS lifting, right? So what is exactly SMAS lifting?
It's called a SMAS lift because the superficial musculoaponeurotic system, or SMAS, is the layer of tissue or membrane that connects your face and neck muscles to your skin. The advantage of doing the operation is that you can break the ligament called the facial retaining ligament. So, with this operation, we can improve not only the overall shape of the face, but the deep wrinkles as well. The fact that we can break the facial retaining ligament and the strength and toughness of the SMAS layer compared to just pulling the skin means we can lift up the face even more.
So Dr. Yang, how many kinds or how many types of SMAS facelifts exist?
When the facial skin of a person is drooping, what we can do is perform a facelift in order to improve it. If we look at the face from the upper part, droopy eyes and wrinkles around the eyes and nose are caused by drooping skin that starts from the top of the head. To improve this, we can do a forehead lift or forehead reduction lifting. If the skin droops to the eyes, the skin bulges beneath the eyes and mid-cheek groove, which results in uneven skin. That can be improved with a lower eyelid operation and mid-facelifts by filling in the empty parts. And in the outer and bottom part of the face, marionette lines are made, and this makes the chin line rumpy. To improve the aging process, we do facelifts, mini lifting, and thread lifts. In the case of the neck, the skin droops and vertical wrinkles are made. Wrinkles across the neck are also created. In this case, we do neck lifting, and to improve vertical wrinkles, we perform neck plastic surgery, or operations that tie the muscles.
So you introduced us to the different types of SMAS lifts. What's the difference between those?
The differences between the operations and combinations between them are how we improve the drooping skin. For example, with the procedure of forehead lifting, based on the width of the forehead, we cut it open or lift it using an endoscope. Through forehead lifting, we can lift the drooped skin so the person who takes it can have big and well-defined eyes. So I recommend this procedure to people who want to have that. And for lower eyelid operations, it's great if you want to improve the bulging part of the face that we call the mid-cheek groove. Usually, the lower part of the eyes are bulging out, as in many cases, the mid-face area is sunken and rumpy. In cases like those, along with the lower eyelid operation, if we include the lower part and lift it, the mid-facial area will look significantly better. For facelifts, I usually recommend the patient have both the facelift and the neck lift together. That's because people whose faces are drooping would also have drooping necks, and there are numerous wrinkles. For some operations, we can perform the cut for it a little longer in the back and pull the skin back in order to get a more polished face and neck form during the end result.
Okay, perfect. So usually what's the average time that takes to do this procedure?
Forehead lifting, the operation will last about an hour. For the middle part of the face, lifting it will also take 1 hour. However, for the facial and neck lift, the operation could take from 2.5 to 3 hours. This is because pulling the skin would normally take less time, but for facial lifting, I usually do SMAS lifting. If we do lifting through D-plane, the exfoliation area also gets wider. You also need to take into account the facial nerves, so we need to take extra care. That's why it takes around 2.5 to 3 hours.
Is it a painful procedure? Does it hurt?
Since the duration of the operation is longer, there are people who worry that it might be painful, but you're put to sleep during the entire process of operations like these. So, When you wake up, the operation is over, and most likely, you won't feel any pain. And even when you're put to sleep, we also administer local anesthesia as well, which is why patients can't feel any pain.
And for the results after the surgery,
네.
do they last for a long time? Are they permanent? How long do they last?
People who inquire about this operation are often curious about how long the operation's results will last. It is true that we do aim to have the results last for a long period of time. This operation's aim is to reverse facial sagging and the impact from sagging back to its original look. So when comparing operations before and after results, we want the face to recover about 10 years of time, even right after the surgery. We can say that the operation is more about restoration. Let's compare a person who went through the surgery and another person who didn't go through the surgery. If we observe these two for 10 years or so, the former will still look about 10 years younger. So, to answer the question of how long the results of the surgery will last, it would be that the operation will make you look 10 years younger. And after we pull the parts back, the flow of time continues, and the tissues in that part will also age as time passes. But don't fret, that doesn't mean the results of the lifting surgery will suddenly get undone, nor aging will be faster. The aging process will still be gradual, like everyone else's, as time passes.
Okay. So what kind of patients do you advise or can have this kind of procedure? Does it depend, for example, on age, or does it depend, I don't know, on the...
So, if you have a sagging face, you would consider many options to improve the sagging. So if you have marionette lines from sagging skin, if your retaining ligaments cause cheeks to sink, and so your face is overall uneven, if your buccal fat sags quite a bit, causing your chin to look uneven and wrinkled, or if you have an extreme case of skin sagging, all of these have solutions. Some people who have facial sagging, either due to nature taking course or caused by facial bone reconstruction surgeries, these cases could easily be improved by these facial lifting operations.
So what are the side effects of SMAS lift?
네.
Well, the most common side effects of SMAS lifting is bleeding and swelling. To prevent bleeding and swelling, we insert something called a blood pocket. The function of this device is to suck out the blood. And we also put on compression dressings. And these blood pockets are typically removed 2 to 3 days after the surgery. And so even if it makes you feel a bit uncomfortable, you should keep in mind that this is to help prevent swelling and bleeding. Another possible side effect is skin necrosis. This doesn't happen quite as often as one may think, but skin necrosis can be caused by blood circulation problems. During excessive bleeding, excessive swelling can happen, and the end part of the surgical area could have less blood circulation. In that case, levels of skin necrosis could differ widely, depending on how long this condition lasts. The hospital can take care of this problem depending on what the situation is like. But it is best if skin necrosis does not happen at all. And so, you should heed carefully to cautions that medical staff advise you so that you can prevent skin necrosis. Lastly, the part that's most concerning is paralysis. After the facial lifting procedure, you could temporarily feel numbness right after the surgery. This numbness, however, typically goes away after 3 to 5 days after surgery. But if there's been neural damage during the surgery, or in some cases, your nerves may have loosened a bit due to the facelifting procedure, in that case, it could take up to 3 to 6 months for recovery. Usually, paralysis takes place on either side of the lips, and so it might feel a bit unnatural, but the numbness typically goes away, and so you don't need to worry too much about it.
So after the surgery, what do you advise the patients to do for recovery or to take care of their SMAS lift?
After the surgery, the most important thing to do is taking care of the swelling. In the first 3 days, it will continue to swell. We'll put on compression dressings, and so you need to take care to maintain this dressing. and you should continue to put ice on the area. And when you're sleeping, instead of lying down flat, you should sleep while sitting and leaning against something. This will make sure that there won't be any more swelling. And so, after 2 to 3 days, we will remove the blood pocket, and along with that, we'll remove the compression dressing too. To keep pressure on the spot, leave your face band on for 2 weeks so that there won't be more swelling. And after the blood pocket is removed, light exercise is a good thing. You should take frequent walks and move around in order to help your blood circulation and get rid of swelling. Avoid squatting, leaning forward, or bending down in general, so there won't be any sudden surges in blood pressure. One more thing to point out, as we discussed skin necrosis earlier, it's best to avoid smoking for at least a month after the procedure. And you need to constantly put on that face-lifting bandage during the recovery period. You can take it off for a bit when eating, but don't forget to put it on while sleeping.
Okay, so we're talking about recovery. Usually, how much time does it take for full recovery?
For complete recovery, it'll typically take about a month for the swelling to disappear. So I typically tell my patients that it takes a month for recovery. But typically, if patients recover without much discomfort, they can remove the stitches in 7 to 10 days. And then, the swelling goes away quicker once we remove the stitches. And so, typically, most of the swelling should go away in 1 to 2 weeks. But after a month, the patients should notice a huge reduction in the swelling.
So, what people cannot do this kind of SMAS lifts? Are there people who cannot?
Usually, there aren't any huge difficulties in facial lifting procedures. But sometimes, in order for us to operate within a safe criteria, we can prevent bleeding by telling patients to avoid taking aspirin. Or if you're taking any other medications that prevent blood clotting, we advise our patients to stop taking them for about a week. And so, if you have any existing heart conditions or any other medical conditions that can cause an embolism, we can't carry out the procedure. So far, we've discussed facial lifting procedures. If you have any questions regarding the procedure, you should reach out to our clinic or leave a comment on this video, and I will personally reply to your comments. You've been watching Dr. Yang Song-hyuk from Hugo Plastic Surgery. Thank you.